Western Spring Television. Ours it is.
Yes, good afternoon, viewers at home. You're welcome to your darling program, The Spring Clinic. We are here with another interesting discussion this afternoon. It's an interesting one because it has to do with the mental health generally. And particularly, we are going to look at the peculiarities of women and their mental health. Of course, we say that they said we are equal, but beyond being equal, we are uniquely different. Because of our unique difference, we also have unique challenges which reflect profoundly on our mental well-being. We have somebody in the house who is a female, a distinguished fellow of the National Postgraduate Medical College of Psychiatry, who works at UniOsun Teaching Hospital Department of Psychiatry. On another hand, too, she's also a pastor of a church that she co-pastors with her husband. I have the pleasure of inviting, bringing or introducing Dr. Mrs. Adeola Oduyebo. You're welcome, madam.
Yes, good afternoon, everyone. It's a pleasure being here.
I think people at home will be curious. Why would somebody, a female, somebody of your frame, they will expect people who are hefty to go into psychiatry? Because one man asked me that his daughter likes psychiatry and he doesn't, that she's not too physically well built. How is he going to withstand this violent and aggressive patient? So what do you have to say about that? What struck your interest and how have you been coping?
I'd always thought of doing mental health since I was in medical school. Of course, there was a time I was thinking of pediatrics because I love children, but I ultimately came into mental health. And I still, as Dr. Yewale, who is one of my trainers, just saying, I just remember the first time my present HOD, Dr. Adebayo, saw me in the department years ago, about 10 years more ago. And they looked at me and said, look at your size. Do you think you can cope here? Kind of our patients. You know, really, it has nothing to do with the size. It has to do with the training and your capacity to be able to manage the patients. That's what is more important. You may have the big size, but you may not.
But what actually struck your interest in studying mental health to becoming a psychiatrist?
Okay. It's funny because I must tell you, I'm a Christian by religion. And when I was in medical school, I initially thought that all people who had mental illness were demonically possessed. And I think I need to go there so that I cast out all the devils. That was the first thing.
I mean, that was the passion, the initial passion.
Yes.
Why will some demons be disturbing people's mind and making them unstable and unuseful for their lives? That's good.
And then I was now doing the psychiatry posting and all that. I found that it's not really about all the devils. There are many other things that can cause mental health problems.
Yeah, so You're welcome to the discussion this afternoon, madam.
Thank you, sir.
Yeah, so let's look at what is actually mental health. When can we say that somebody is mentally well? Because you see, people have a way of accusing us as psychiatrists. They say everybody that comes around us, we label them as mentally ill. That they are even thinking that maybe we ourselves, we are also not mentally, we are not mentally well. So what is the idea of mental health really?
Thank you, sir. You know, I first want to laugh when people talk about mental health. You know, they use the word psycho. They use the word colo. Or they say something like arrow.
Yes.
You know, but those are words that stigmatize people with mental health problems. And maybe I will start with definition of health. Definition of health says that is a state of physical, social, and mental well-being, and not merely the absence of a disease or infirmity. And so it says, in a nutshell, that if there is no mental health, there is no health. Many times people think of mental health problems having to do with the disheveled man on the streets. And that's one of the reasons, the problems we have with people.
So you mean it's not, you mean, the point you are making is that it's not only the person on the street walking around half naked, yes, talking to himself that is mentally ill.
Yeah, yes, sir. So mental health, the definition by the World Health Organization defines it as a state in which the individual gets to a point in which he can realize his or potentials. That means he is capable enough.
Self-discovery.
Is able to do.
I know myself.
Yes.
This is my potential. Yes. And I can unleash that potential. Okay.
Then he can manage the normal stresses of life. You know, stress is normal as far as this world is concerned. So there are some kind of stress which includes divorce, separation, losses that are common.
Even workplace here.
And workplace, yes.
Like some of our cameramen, our producers getting impatient and then...
I'm playing up.
So at times, you know, they could overreact.
Yes.
Okay, so if somebody does that, even in the workplace, and it's already affecting him psychologically, yes, we could also put that person, yes, somebody that may need some attention.
Yes, may need some attention. Okay. Especially if it's becoming... a pattern,
becoming recurrent, yes, and it's already affecting that person's functioning. Yes,
okay. And you know that's the third part of the definition of mental health, is that the person can be productive and fruitful, you know, and then the last one being the fact that the person can make a reasonable contribution to his environment, can influence his environment.
Well, these 4 criteria are strong.
Yes, sir.
It means by the time we begin to apply them to the population, a good number of people may not be mentally well. Because discovery of potential, how many of us are actually aware of our potential? Talk less of unleashing it. Number 2, in our environment here, we condone a man coming from work, he's tired or he has 1 or 2 challenges in office, and he begins to transfer it to his wife. People think it's a normal thing. Children have grown up to know that when daddy comes, you run into the house or so, to the rooms and all of that. And of course, being productive, people think it's optional. I mean, it's interesting to know that you need to be mentally well to even be productive, to come to work in the morning, earn a living, and not be a burden on others.
Yes.
And of course, contributing to society.
Yes.
Yeah, that's quite interesting. But you see, there's this belief people have that we overdiagnose mental illness. Can you shed light on it so that people can begin to have an insight into what could constitute a problem and they can seek help? Why I'm saying this is that there are some behaviors people I'm not talking of us as psychiatrists.
Yes, sir.
Some people think it's normal and should not be looked at as a form of, as a complaint of mental illness. So how can you please shed light on that?
When the behavior of the person is so much affected in such a way that it affects the person on its own, becomes a problem to the person and becomes a problem to the people around. When everybody starts complaining about you and starts complaining about certain things.
Like work? What if I'm working and you know it's good to work? Can my work, my attitude to work be a presenting complaint for mental illness?
The attitude to work depends on the perception of the people around you, what you are meant to do, and what you are doing. For example, somebody who is employed to work 8 to 4, gets to work, works 8 to 4, does his own work, looks for other people's work to do the same. It's time to go home. He doesn't go home or goes home late, gets home.
Is not the kind of person that
does not
excuse
sleep.
me, madam, is not the kind of person they want to give the prize of the most hardworking person in the place of work.
When it gets out of proportion, of course, it's good for people to be hardworking, and it's good for you to go beyond what you are given to do. But there is a state in which it becomes excessive, that it keeps you don't rest, and it has begun to affect your relationship with other people, with members of your family, and then it has also begun to affect the way you respond and react with people, your relationship with people. So you find that mental health issues will affect the person's personal functioning, it will affect the person's occupation, it will affect the person's relationship at home, and then will affect the person's relationship with people around, what we call the broader social context.
That's very interesting. So that by the time any behavior, even no matter how good we call it, begins to affect my functioning, my responsibilities to significant others, and it's beginning to give some distress to me.
And
even though I'm not saying it, but others are already saying it. But we want you to work, but this work you are doing is already causing you some kind of distress, and it's affecting other people whose lives are connected to you. Is a form of mental illness. I think this is an interesting discovery, which will make our viewers to begin to see that because the earlier some of these cases are reported, the better. So that we can have attention. And then get to know. In terms of causes of mental illness, what do you think are some of the common causes? Because in our world now, it looks like the rate at which we are hearing suicide, somebody is committing suicide. We didn't used to hear it before. Let's even start from there. Is it that it didn't used to occur before, or what is happening? That nowadays we just hear somebody wants to kill himself. It's scary.
Suicidality has increased in a sporadic manner, and it has to do with the current occurrence. It used to happen, but it was very seldom. There were so many things in the society as of that time that helped people, such as people realized that the first option was not to kill yourself. They probably feel that then they believe that there were problems in the world and that the problems are meant to be solved. But you know, now some don't think there should be problems, and so they feel that I don't think this is
some people feel once there's a problem, that's the end of the world.
Yes, that's the end of the world.
Okay,
and then the social way, the community life people lived then made it easier for many people to cope with situations and problems.
How do you mean?
They had the older ones, they go ask for counsel then, and those ones are able to tell them, oh, this is not new, this has happened before.
We also have the extended family system.
So
now everybody is me, my wife, and my children.
And me. And you know, people don't want to, how people will say, I don't want to expose my bum out. And so for that reason, many people keep what is wrong with them. They internalize the problem and then they react and they respond, because that's a normal thing. So we found out that mental illness is caused by a number of things. And people must know that the first thing many times people think is, oh, it must be a spiritual thing, one devil has entered and all. But let's see things this way. Many times when people have hypertension, somebody is asking, oh, is there a family history? And like, wow, my dad had it. Have you ever wondered why the old times when there's a suicide case in the family or there's a case of epilepsy, people go ask when people want to get married, they say, go find out in that family if there's suicidality or there is epilepsy.
But it was stigmatized.
Yes, it was.
I think because of the stigma, oftentimes people don't want to own up to it.
Yes, and so it's kept and nobody wants to say this has happened.
So because it is kept, oftentimes the first time some people will come down with mental illness, maybe the time they actually want to commit suicide or they have committed suicide.
And they have committed suicide, which has become more rampant. There was one that happened in the nation some time ago, And it was after the young man had killed himself, a student in one of the states away from her, that the woman beside him said, "Oh, I noticed that his behavior had changed. I gave him food. He naturally will collect my food, but he refused it this time." But she probably just felt, it feels like not eating. You know, that's where the social support thing is, when people are unable to quickly see what is happening around them. And
so you may be talking to parents.
Yes.
What do you think parents can look out for in their children that could signal a possibility of a visit to a psychiatrist or a psychologist?
Okay. Parents are very important as far as mental health is concerned. And even when we're talking about an institution, we see that the smallest institution is the family. The family is very important. It's very important as far as all kinds of description is concerned, even the spiritual description. The family is very important. And the first set of people who are meant to help children are the parents, and they are the first to know when children have changed. I've had situations in which by the time the child breaks down completely is when the mother starts saying, now I can see that she used to stay in her room. She does not come out. So parents have to be very observant.
So they need to sense when there's a sudden change
in their child's behavior.
How do they approach it? Some of these children are difficult to interview, to get things out of them. How do they go about it?
The first thing is that parents must know their children. You must know your child, and you must be close to your child. You know, I remember talking to someone some time ago, and she said, no, the first thing, I'm not meant to be their friend. I must tell you, you should be the first friend your child has. Your child should be free enough to tell you when things are wrong and when things are not wrong. There are some children that can't walk to their parents and say, oh, I've been feeling very sad, I don't know why. And that's when the parents are able to know this is wrong. But when your child cannot approach you, and the child gets you in Yoruba, or the Yoruba child say, Kini, what do you want? And the child is like, oh, no, I can't approach you. There's a young man that gave a story after he had changed and had become somebody different. But, you know, by the time he started taking substance, which also can lead to any of those kind of mental illness, which includes depression, which includes suicidality, which includes psychosis that everybody knows. He wanted to discuss with the parents, but the parents were too busy. So that's another problem. Especially now when there's a rat race, everybody wants to have everything, the flat screen, you want to go abroad, you want to do this, you want to
parents are not available.
The parents are not available.
And watch if there's a change.
Yes, if there's a change. That's the difference between now parents and the old parents. That's why it has increased now. Because the old parents probably after work come back and they will spend some time at home, and for that reason they're able to notice this child has changed, this child has not changed. But he said the parents were too busy, and you know, he tried discussing with the father. The father thought it was money he wanted to ask for, and so the father said,
give him more money.
I don't have time. No, he even said, I don't have time. I was trying to escape it. See your mommy, see your mommy, see your mommy. And you know, the mother came back. He was saying, Mommy, I want to talk to you. She said, oh, I'm tired. And she said the next day he just felt like not discussing, but he wanted to tell them, my roommate has introduced me to a particular substance. And I'm now taking it. This was somebody who was admitted in University of Ibadan for medicine.
Wow.
Of course, he ended up getting into drugs. He ended up a dropout.
Wow.
He couldn't tell his parents he had become a dropout. He got into armed robbery. He ended up being a factor that even killed his mother.
Wow.
You know, and so it was a tragic situation. But where did it start from? Parents who were not available. And so parents, it's important, no matter what you want to become, no matter how much you want to make it. I'm not saying you shouldn't want to become, neither am I saying you shouldn't want to make it. You have to know that your first responsibility is your children. And you need to be able to care. That's what it is. Care enough to understand when things
this care,
are
is
changing.
it not a bit strange to our culture? Because how can me and my son be exchanging views? I think, is it not strange? How do we learn it?
You know,
because oftentimes some of us just want to give the instruction, and then it is you children go and meet your mom and be talking all those things, you know?
You know, there are different types of parenting, and they found that you have the permissive parenting, parents who don't see anything. You have the authoritative parenting, he decides, and you have the neglectful. the one who, does not care. Whereas you have the authoritarian, which is the one who takes time to listen. And studies, a number of studies have gone out, and they found that the authoritative is more, the authoritarian is better. That means the parents and the child can talk. You know, I must also tell you that times have changed. You know, in the old, people could cope better with parents who were authoritative. Daddy says this and every child cringes and just says this is what daddy has said, even though there were still some failures then, but it was minimal. But now, that kind of parenting will not even help at all, because children have become more enlightened, we have become more westernized than before. So children now ask themselves questions and even have some of those situations on their minds, and they go ask people who will listen to them. And some of those people who will listen to them will give them the wrong counsel, and they will not be able to.
And that's when we talk about the peer pressure.
Yes.
The peer pressure becomes dominant.
Yes, sir.
When the parents have failed.
Yes.
Yeah, so let's talk about women.
Okay, sir.
Women are special people.
Very special. Very delicate beings. That's what the Bible calls
But are they really delicate?
No, we're just special.
I don't think women are delicate. Do you think they're delicate? I don't think the women are delicate. I think you people are stronger than us.
No, okay.
Mentally?
The word delicate actually means not just weakness, but something that is very special and precious.
Sophisticated.
You know, for example, if you are conversant with glass cups, you will find that the delicate ones are very light. The very delicate ones can break very quickly if you don't take care. So that delicacy means that.
But in terms of resilience, don't you think women are more resilient than men?
Yes, I think we are built that way.
So somehow, I don't like this word that they are saying they are delicate or they are weak. However, I think you people are made in a very different manner.
Yes, sir.
Now, this way you are made, how does it relate to mental health?
And the female gender is a very special one, as I said, and we have different functions. You know, the female is a sort that whether she plans to multitask or not is right there on her table. She has a number of things to take care of. She has the fact that she has the caring part. She has to care for the children. She has to care for the husband. Yeah. She has to care for the in-laws. You know, Professor Mayberry will call them women in the middle. You know, they are the daughters and they are the daughter-in-laws. And you know, they are the ones who think and who are expected also to think more about the parents. You know, and so you find out that people are going to say, where? This is more on a lighter note. I remember some years ago, I was a resident, and that's why I was in my place. I was on call and all that. I wasn't at home. And then I had the house help. My husband, of course, also was at home and all that with the children. Yeah. But you know, the house help, while dealing with hot water, allowed hot water and poured on my son's leg. You know, and so they called me and I said, oh, take him to the hospital immediately and all that. And you know what one of the nurses who knew me in the hospital did? He called me and said, well, where are you and what are you doing? You know, he didn't even ask. You know, I mean, they should ask my husband. Where is he and what was he doing? But you know, they don't care because women are expected to do a number of things, and that has cost women a lot of problem trying to negotiate that bend. And yet we go to work and we are also expected to perform at our place of work. Then we face a society who may also be patriarchal.
Yes, and then having a lot of bias.
Yes,
anyway, this is an interesting discussion, madam. We will have to go on a short break. We are having Dr. Adeola Oduyebo, a consultant psychiatrist with Junior Show Teaching Hospital. We're discussing mental health in general, and then we're at the segment where we are looking at the peculiarities of the mental health challenges of women. We'll be right back. Thank you.
Turn it up! It's the Wild Wild West, and Western Spring Television is pulling out all the stops to make sure that you don't miss out on every of the fun and happenings around here. Yup, we've got you covered because your girls got all the juiciest tidbits and entertainment news from around the world. cross over to the chocolate side of entertainment. Join me, Chocolate Cassie, on Eccentric as we take you into every bit of the juiciest news, fashion, music, movie updates, and other trending conversations. Together on the show, we'll get personal with your favorite celebrities via phone call, Zoom, or even live here in the studio. Eccentric will be showing on your TV screen on Western Spring Television, channel 190, only on Star Times.
Arrested, affected, sound, found. What do we see? What do we say? Flowing from a spring. A fact A to Z. Check and confirm. Ever expounding current events. Traveling down from the business gist to the globally arising happenings, to the sports news, to the bittersweet infos. Guided transmission, even diffusion, vast and fast, detailed facts are fled. Within seconds, nuggets of words that flew across borders are fired. Stories short and long, wrapped in bundles of words, broken and dissected as it is, except misheard. This is the news as it is.
Sports is a culture on its own. It has its own language, its own people with their own way of life. The world of sports is never void of actions, stories, dramas, and scandals. I guess you need a sports show that can walk the walk and talk the talk.
On this show, we answer all your sporting questions. The whens, the whys, the wheres, and even the what ifs. Sports Spring is that show that will give you that new lease of life you've been looking for in sports journalism. Join me, Joseph Atewe,
And your sports Amazon, Nengi Ernest.
on this station, Western Spring Television, channel 190, only on Star Times.
Let's talk sports. Let's speak the most universal language of the world.
Evelyn Ohiole,
Hi.
King Eve. How are you today?
I'm good, I'm fine, I'm alive.
I really feel like she's not giving the right answer to the question. When one asks you, how are you? And you said, you're saying, I'm alive. It's very annoying, seriously. How are you? I'm fine. I feel I'm fine will be the right answer instead of I'm alive. Not that I asked you if you're dead before.
Go and check all these 14-year-old, 15-year-old, 16-year-old, everybody, they are extraordinarily sexually active.
I feel is being unnecessarily hyper when it comes to the issue of sex, because we talk about other topics and it feels so reserved. It really doesn't have anything much to say when it comes to other stuff. But when it's the issue of sex, I believe he's being unnecessarily hyper. That's when I have to pick an issue with him. I mean, it's just being unnecessarily there when we're talking about sex. Just like a child, his mom just got him his favorite chocolate or ice cream, very happy, doing as though he doesn't have sex for a day, he's going to die.
When it comes to finance, women also support their husbands financially. You need me emotionally. You need me spiritually.
Cassie is an amazing person, but I hate the too much attachment to that gender. I need you spiritually, I need you mentally. I can get these things anywhere with money. If you go by the topic was, who does marriage favors the most? I know how many jobless women they marry every Saturday. They're saying it favors you. I did vex so.
Growing up, when I was in the world, we've heard of
Who are you now?
Well, that's too much said. It likes saying when I was in the world. And the last time I checked, well, it looks a bit innocent, facially, but deep down, is actually out of this world. We're all in the world now. As long as you're alive, you're in the world. So, too much I beg when you talk about that. I don't want to hear that. Next time you talk about like he's on us.
think they have a problem with you saying ladies are champion, and that's the problem. Always trying to attach so much importance to that gender.
It's giving insecurity, it's giving low self-esteem, it's giving a blatant display of egoism, because at the end of the day, a man who is secured in his word, a man who is confident of who he is, will not really be disturbed as to whether women are being referred to as champions or not. I mean, at the end of the day, Joseph's a really great guy, but whether he likes it or not, women are champions.
Yes, viewers, you're welcome after the short break. You're welcome to your favorite program, The Spring Clinic. It's a platform where we have an opportunity to bring experts to speak to us, enlighten us on a lot of our myriads of health challenges, and also to even bring end users to talk to us on what are their experiences. This afternoon, I have the privilege of having Dr. Mrs. Adeola Oduyebo, a consultant psychiatrist with Uniosun Teaching Hospital, speaking to us on mental health. And then, of course, we are at an interesting segment where we are talking about the peculiarities of the mental health of women. And I think before we went on a short break, we were looking at what are some of the causes of mental health problems in women. We looked at the fact that there's a lot of challenge.
Yes, a lot of
the wife,
caregiving challenge.
Caregiving, yes.
The wife, they take care of themselves. They're meant to take care of the husbands, the children.
You mean that could actually give some people...
The parents-in-law, yes. The burden of the stress on depending on the capacity of the individual. Many times everybody feels, okay, this person is doing it, you should be able to do it. And so the incapacity to be able to manage that normal stress can make the person break down mentally, and then it becomes a problem.
What other circumstances do you think women can actually? How about childbearing?
Yes, I was going to go there. The problems of the stress involved in pregnancy, the stress involved in breastfeeding, and you know, with that stress at times affects some people such that they have what we call infanticide, in which they end up...
They want to kill the baby.
Yeah, they want to kill the baby, you know, and then sometimes some of them can even have what we call phobias in such a way that they now get so scared of probably going near the baby because they are afraid, they have some obsessive thoughts that is making them feel that, oh, obsessive phobia, I may end up wounding this baby.
And I think it's quite established in our culture that women at times, some certain women have mental illness after childbirth. Yes. What do you have to say about that?
Well, you know, in after childbirth, we have what we call the maternal blues that can happen to about 28 to 80% of women, such that they have these symptoms of depression and all that, some days after delivery and all that. Of course, that one goes itself, you know, but with being managed well because of some of the stress involved in childbirth, the stress involved in, oh, a baby has come, how do I manage and how do I take care of this baby? Then some may go have what we call postpartum depression. That's the fact that after delivery, they may come down with full...
It's interesting that you people look at the period after childbirth for a whole year.
Yes, yes.
The obstetricians don't look at it that way. I think the obstetricians look at, is it 40 or 42 weeks?
Yes.
But you psychiatrists feel that a woman can still come down with mental illness after a year after childbirth. Why is it like that?
Because of all that is involved in taking care of children, a baby, for example, or some already even have children. Some have children very close to the age of the baby. So that other child is wondering, why? Where did this one come from? There's a woman that I had to laugh at her, the daughter she had just before she had the other one. And you know, she just looks at her and says, Mom, has the baby poo-poo now? The mom says yes. She says, so I'll poo-poo too. And she pulls on herself. This is almost 3-year-old. You know?
So the woman is, as the woman is taking care of the baby, is taking care of the
taking care. So she just said, Dr. D, I'm fed up. I don't know what's wrong. I don't beat them, you know, that kind of a thing.
And that could actually make some women break down.
It will make some women break down. So we've had people who have postpartum depression after. Some have even
some will even break down,
you know,
and begin to
and you know, and then looking at this the culture, when the mother-in-law or the mother sees that, they want to quickly hide it. They will say, because immediately they begin to call it names that stigmatizing.
How about marriage? Can marriage be a cause of mental illness for women?
For women, for some.
Even for men. Maybe one of these days I'm going to bring a male psychiatrist too. I will talk about the mental health of men. Because I think women's mental health have been overflowed. What do you think?
No, I think it's all because of the challenges. And you know, many times some say marriage is actually protective for the men, but it's problem for the women.
Really? But how does marriage cause?
I don't think
I think because of our patriarchal nature, we hide a lot of our complaints.
Yes.
Some people mask it with alcoholism.
Yes, and that's why men are more involved in substance use. But women are emotional, and their compassionate being makes them more at risk of certain types of mental illness.
As a result of marriage.
Yes, and then, you know, at times there's this macho thing, you know, that some women, even when they begin to have some of those symptoms, they don't want to say it. Rather than say it, they keep it to themselves, and then before you know it,
maybe stigma. Maybe they are just afraid of being labeled.
Yes, actually some that hear voices of, you know, somebody really can be depressed and yet still hear a voice. And
how about our young ladies? What do you think what do you think about their mental health? What can you say about some of the peculiar nature of their mental health and the problems that could predispose some of them to mental illness?
For young people, we also must know that it's the female that has the menstrual cycle. So we start from there, that when lady gets into place of puberty, you know, some don't even want to get to the place of puberty, and then they get what we call anorexia. For that reason, they don't want to menstruate, they reduce their food intake, they do this, maybe because they have a negative connotation to the fact that I don't want to get involved in this. And I know some also, even during the menstrual period, which men don't have, they have what we call the premenstrual tension. Just some days or within the menstrual, they begin to have, some get to the point of having moods here and there. They just
so before some women actually have menses, they can actually have some changes in their mood.
Yes, personality changes.
Wow.
Yes, and you know, and those people that don't understand will not understand. One of my lecturers, when I was in preclinical school, will tell us, then he will say, oh, my sisters, he called us sisters as us medical students. He will say, please marry a doctor. A doctor understands. You know, he doesn't understand when you have your menstrual, you have those symptoms, those changes and all.
Because the man doesn't understand, excuse me, what's wrong with you?
Yes.
You don't have malaria, it's not that you have any other illness. Why are you this one that you have?
Change. So mood changes and all that. And then he says that, you know, when those times go, okay, they get released and they are, but all those are hormonal changes that make some behave in the ways. And we also have the premenstrual. What diagnosis we call premenstrual dysphoric disorder.
So it could get to the point at which even psychologists or psychiatrists may need to see them.
Yes.
When it becomes very bad.
When it becomes very
and it's
bad.
Not like abnormal. They need to seek help.
Yes, they need to seek help. And you know, and then the same, whether young person or not, may still have some of those other symptoms, get depressed, probably jilted by somebody,
relationships.
And you know, relationship problem. You know, for example, in the African setting, it's expected that once you're a particular age, by now we should be seeing somebody. These are parents that did not encourage you to be in a relationship before. You know, they are like,
so pressure.
They are asking, wondering who is he. And then once you are almost done, they are asking you, so who now? It's like, did you think of that before? You know, and then the pressure, the lady is becoming 20-something, 30, and she says, I can't be. And for that reason, she can get depressed because somebody is giving her pressures here and there. Somebody was talking to me, I was just talking to a lady about a week ago, and she's about 40, and she said, you know, won't believe that recently my mother came. She said that weekend, my mother came to my house. I started crying. And she had to look at her. She said, Mommy, so there's nothing good about my life after this marriage thing. You know, I mean, I have a job. I'm healthy, and they think of
I
some
support
of those
you.
things.
I support the family.
Yes, and don't now cry. Do you think I don't want to get married to? Do you think I'm, you know? So a situation in which people are able to put themselves in the position of those people, give them so much pressure. And you know, in the African context, we just assume you are the one. Maybe you are becoming too. You are doing the big girl syndrome. For some, it's not the big girl syndrome. It's just that they haven't just found the right person. And you know, those same people then push in some, and then they get into the wrong hands of the wrong men who probably butter them. Some are like, let me just get that ring. Let me just, even if it's 2 days, let me just get married. And they don't know that it will end up giving them more sorrows and
for the rest of their lives.
For the rest of their lives. And then at times some get into relationships, abusive relationships, and then just go on to say, let me just get married.
But of late too, I've started seeing that women are also getting recruited into the drug culture.
Yes.
What do you think is responsible, and what advice do you have?
It's funny that the prevalence of the male, female on drug use is becoming very close to themselves.
I'm worried. Why is it like that?
One of the reasons is still the peer pressure thing, and then people are finding it more difficult to look for better ways to manage problems. You know, when people have not been able to understand that there are problems, and nobody should get people to think that problems don't exist. And at times pastors, I'm a pastor too, we can be culprit in helping people feel that everything must always go well. But forgetting the fact that even for me, in the Christian religion, the Bible says that the troubles may be many, but God has a way of solving them for you. And so when people don't understand how to solve problems, and that's why parenting is...
They get overwhelmed.
Yeah, they get overwhelmed, and then look for the next set of things to get them out of it.
And that's why chemicals
get into substance use.
Thank you so much, Dr. Oduyebo. I would also like to ask, what are your counsels for a lot of these problems, starting from the general mental health problems, then the female peculiar problems to them? What are your counsels for them? What can people do?
Yes, sir.
You know, when they begin to see that, because that's a problem. Most of us don't want to seek help, especially when it comes to mental health. We can go to doctors for any other thing, but when it comes to mental health, they don't even know where to go. They don't know how to approach it. Please, can you help us?
I want us to see that mental health problem does not mean madness. Does not mean weary. And I tell people that the madman is the one on the street. The wearing coat is the one on the street. And that person became that mad simply because nobody was available.
Loss of support. Nobody took steps.
No social support. And so I want you to understand that mental health problems exist, and that does not say you are mad. And then you need to begin to learn to seek help. And if you don't have somebody close to you who can help you understand that they are mental health physicians, we are here to let you know that they are mental health physicians.
Where are they? Where can people?
In the teaching hospital. You know,
and I think in Ashubiaro,
you get them. In Bomosho, in the number of teaching hospitals and some of the state hospitals, you find that. And then some you have even private hospitals. They can tell you there's a psychiatrist, there are specialized psychiatric outfits.
I also think even in some of our general hospitals, there are nurses, psychiatric nurses.
Yes.
Who, you know, because we don't have many psychiatrists around, we need to thank for a few people that are here now. The rate at which psychiatrists are getting out of this country is scary. However, we still have psychiatric nurses who could actually also guide them correctly.
What to do.
So they need to seek. They need to go to.
You need to seek help.
Yeah.
And then you know, one of the also problems why people break down, have mental illness, which will now lead me to how to solve it, are stressors. Stress will come. But you must know how to handle stress. You know, you must know that you can look for good people, mentors, and people to discuss your stressful situation. The fact that you have the stress does not mean you're broken down mentally. But those kind of people can help you out of it. Don't go to people who will tell you maladaptive ways of handling a wig, which says, okay,
use of chemicals, alcohol, and then you get hooked onto alcohol.
And then you get hooked. Many people who are hooked on those substances started that way. And they just felt they can't control it. It's just a bottle today, 2 bottles the next day is not too much. I'm okay. and before you know, they get hooked, and they even find it difficult to come out, and it becomes a serious problem and ends up affecting their mental mind and even the physiology of their body, and for some it ends up taking their life.
Now when they come to see you experts, what are you guys going to be doing to them?
When mental health, when you see a mental health physician, we get registered, and then we ask you a number of questions. I must tell you that it's not all mental health problems that will need to prescribe medications.
Because people are always afraid of your medications.
Yeah.
They say when somebody is taking your medication, it looks like they already know them. Is it really true?
You know, that's not true. That's not true. You know, of course, you know, there are times that people get to some points where they feel, okay, I'm not in control of myself anymore. You know, maybe because of this drug I'm taking. But when you get to a mental health physician, they know how to moderate the drugs. Don't stop the drugs until you go back to them. They know how, maybe you are getting
even the side effects,
now.
There's a way they can manage it.
There's a way they can manage it.
And nobody will know. A good number of persons take these drugs.
So many people take, professionals here and there, even medical doctors.
No, but I hear that
you don't know about.
No, but I hear that it's only your drug that people take for life.
That's not true. That's not true.
Oh, really?
It's not so that our drugs are the ones people take for life. But we first want to digress before I talk about our drugs. Okay. There are many drugs that people take for life. Like, for example, the antihypertensive, the antidiabetics. But it's easier many times to say, my BP is high, let me go to see my doctor. But when it has to do with mental illness, they don't. But when mental illness is presented to the hospital on time, many times you may not have to take drugs for life.
That's correct.
But I tell people, let's assume your doctor says you will have to take this drug for a long, long time. That does not mean for life. But let's assume your doctor says you have to take this drug for a long time, even if it has to do with life. Whatever keeps you well, it's good enough to follow. There was about some few years ago, I met a particular woman who was taking both anti-diabetics and antihypertensives. And she said, Jola, I've taken this drug for 39 years. Do you know I got to know that I was hypertensive and diabetic when I was having my last child? Now my last child is going to be 40, but she's alive. And she told me I would never have guessed that she was on any medications. But those medications has kept her alive. And I know some other people who were diagnosed the same time she was diagnosed, but who just chose, I'm not going to take this drug, probably dead.
But we learned that you don't really cure these people. Is it true?
It's not.
They say you suppress. I don't understand that language.
That's not true. There are a number of our patients who took drugs for a while, and they are off drugs now.
I mean, symptoms like hearing voices, when they take chemicals, those drugs, it goes away?
Many times, from practice, from studies done, many times it goes. And the people begin to function well. I remember a pastor's daughter some time ago who began to have some of those symptoms, and initially they were taken to a particular hospital. They got resolved, but stopped it, and then the symptoms came and they just concluded that, oh, you're shaking your shake. Yes. And they went from one mountain to the other. By the time we saw at the University Teaching Hospital, it had become more chronic. This is a graduate who, since graduation, had not been able to function.
Wow. And
then I sat them down, talked to them, and then began to show them examples. And one of the examples I showed them was that of John Wesley in electroconvulsive therapy. One of the people that started using electricity to take care of patients who have both physical complaints and some mental health complaints was John Wesley, who was a Methodist pastor. And, you know, incidentally, that man was a Methodist pastor. And so he identified so well. And you know what? That time, it was not called electroconvulsive therapy. It was called electricity being used. And I had to tell them, who gave the idea? Who gave the idea? God gave the idea.
Yes.
And it's because there's something about that therapy which we have found to be so effective, and it works so well. So those medications have been very effective.
And for a close, I know you're a pastor.
Yes, sir.
Don't you find a little bit conflicting, your faith and then the practice of psychiatry for a close?
Yes. Thank you. That I must tell you that for a number of times it seems conflicting, but it's not. You know, when we look at the word faith is a belief, and a belief in a God that can do all things. And I have come to see that God works when we pray, and he answers when we pray. But that same God is the one who made the physicians, and he uses them many times. I see this many times when there's an accident on the road. Oh, for example, we hear Lagos Ibadan Road, there's an accident. What do we say? See devil, see devil. But we will carry the person, where is the nearest hospital, and take the person straight to the hospital.
So God is not against.
So God is not against this, but it's difficult many times for us to understand that.
Yes.
And I use this example at times.
Yeah.
If you look at the story of Hezekiah in Isaiah chapter 38, you will find that God said he should use the fig. That is God. And if you look at the verse...
We need to go, Mother.
Oh,
I'm sure I'm going to still bring you on this program where we'll be looking at faith and delusion. Thank you so much, viewers, for listening to us. This is Spring Clinic. We need to go because our time is up. It's a pleasure having Dr. Mrs. Adeola Oduyebo, a consultant psychiatrist, with us for this stimulating discussion. Thank you and bye-bye.
Thank you. God bless you.